Hi guys, in this video I'll talk about transfusion reactions. So what are transfusion reactions? These are the adverse effects that occur after transfusion of whole blood or one of its components. So transfusion reactions can be acute or delayed. An acute reaction occur during the transfusion and delayed even after days or even weeks after the transfusion. The reaction can be immunologic or non-immunologic. Immunologic causes include maybe your mismatch or non-compatibility of the transfused blood, and non-immunologic causes include your bacterial contamination of your donor's blood. Now the reactions can range from your mild allergic non-hemolytic reaction to acute hemolytic and even sepsis. In some cases, which is a very rare complication, TRALI may occur, which is your transfusion associated lung injury, and it is caused by the antibodies present in blood donor and they attack your lung and causes the lung injury. Now let's talk about the types of acute and delayed transfusion reactions in detail. So acute transfusion reactions can be your mild allergic, and mild allergic reaction occur when there is a foreign protein in the donor product. The other reaction that can occur is your anaphylactic, and these usually occur in the patient that have IgA deficiency, and that is because they produce alloantibodies against the IgA, means they produce antibodies against their IgA, and when they receive the blood product containing IgA, this anaphylactic reaction occurs. Now in acute transfusion, septic reaction may also occur, and the septic reaction caused by your bacteria or bacterial byproducts. Now acute hemolytic transfusion reactions can also occur, and they result in your intravascular and extravascular hemolysis. Now transfusion associated circulatory overload can also occur, and it occurs when the volume of the transfused component causes your volume overload. And as also already mentioned, TRALI can also occur in acute transfusion reactions. Now moving on to the delayed transfusion reaction. It may be your hemolytic transfusion reaction. Even after days or weeks, hemolytic reaction can occur due to the transfused blood, and it may be due to your increased response to the foreign antigen that the patient was previously exposed to. Now other type of your delayed transfusion reaction is your transfusion associated graft versus host disease, and it occurs when there is lymphocytes from the donor blood and the patient immune system is unable to clear this foreign lymphocytes. Now moving on to the signs and symptoms of your transfusion reaction, there will be itching, and it's a general sign of your allergic reaction, fever and chills, and they may be associated with a febrile non-hemolytic reaction, and they can also be a sign of your hemolytic reactions, TRALI, or even septic reaction. Other symptoms is your respiratory distress, dyspnea or shortness of breath, which may include reasons like TRALI and TACO, that is your volume overload. Now other symptoms include your hypotension, and hypotension is usually seen with your acute hemolytic reaction. Now other symptom is your hypotension, and hypotension can be seen with an acute hemolytic reaction, septic transfusion reactions, anaphylaxis and TRALI. The final symptom we're going to talk about is your hypothermia, and it is seen with a large amount when there is large amount of transfusion occur, and especially of the refrigerated products. Now the complications include your DIC, lung injury, renal failure, hemolysis and even death.